Okay, so we did our presentation on Fragile X syndrome, and my name's Brooklyn,
I'm Kaylee.
and this is our presentation.
Is it going? Awesome.
Okay, there we go. So, just some of the description and characteristics of Fragile X syndrome. Fragile X syndrome is also known as Martin-Bell syndrome, and it is a genetic disorder that is most commonly affects males, but it can also be displayed in women as well. It's just not as common. It causes delays in development, learning disabilities, and difficulties with behavior. Um, some of the physical characteristics, like is shown in the picture here, includes a long, narrow face, large ears, flat feet, flexible joints, a large forehead, and there's also other potential traits that can show up in people with Fragile X syndrome. Some of the behavioral characteristics are things like anxiety, ADHD, and difficulties being in social settings. It's kind of hard for these people to be around like big crowds. They just get very uncomfortable in that setting. So this is just a chart that I found from the Cleveland Clinic. And it just shows some of the signs of Fragile X syndrome, kind of like I just talked about. But some of the intelligent issues are things like low IQ, delay of nonverbal communication, problems with basic school things like math, also, some things that deal with mental health, like anxiety, depression, and OCD, is also common in people with Fragile X syndrome. And some other physical features, like I said, a long and narrow face, large forehead, and also crossed eyes, which I didn't mention earlier. And some behavioral issues like social anxiety, ADHD, and poor eye contact, which kind of goes along with the social anxiety aspect. So, causes of Fragile X syndrome, it occurs when there's a mutation in the FMR1 gene, which is located on the X chromosome. The FMR1 gene, it creates a protein that is called FMRP, and this protein allows brain cells to be able to communicate effectively and properly. In Fragile X syndrome, a DNA section classified as the CGG, it repeats, it becomes much longer than normal, and this causes the FMR1 gene to be silenced. And without this FMRP protein, the nervous system is just not able to develop and function the way that it should. And this leads to the symptoms that Fragile X syndrome creates in people. So, just some impacts to overall development that Fragile X syndrome shows up in people. I found this quote from a peer-reviewed source, and it says, "Humans with FXS exhibit increased anxiety, sensory hypersensitivity, seizures, repetitive behaviors, cognitive inflexibility, and social behavioral impairments." And also, many individuals that are diagnosed with Fragile X syndrome experience neurological issues, a sense of feeling overwhelmed, and avoid social settings that might trigger them. And this is just a picture here that shows the fragile site location, like in an X chromosome, compared to a normal X chromosome.
And then next up for impacts to language development, um, the FXS syndrome can cause major developmental delays in speech in areas including delays just in speech development that puts them at a different level compared to peers of the same age. And then more specifically in expressive language, those who are diagnosed with FXS may have strong vocab but can struggle with complex grammar, with syntax, morphology, pragmatics, those kinds of things, and then specifically pragmatic language. Um, People with this can commonly struggle with poor topic maintenance, with maintaining back and forth conversation with people, with more than 2 or 3 turns, going on more specific tangents, um, and poor eye contact during conversation. It's a major area of difficulty within social settings specifically, and can be compounded by other behavioral struggles with social anxiety and things of that nature. And then for receptive language, people with this can struggle with auditory processing, which then has negative impacts on their overall comprehension. It can be comprehension of single words with grammar, syntax. And again, this is often weaker, or they're at a decreased ability compared to peers of the same age. And then continuing on into sociocultural factors, there can be many factors within this area that contribute to their way of life. But these are some of the main ones that I saw consistently in research, starting with limitations in independence, especially as they are moving from a younger age into adulthood, young adulthood, and then later adulthood. There is a definite struggle where they still rely on their caregivers or parents, whatever that looks like for them, in a lot of different areas. So it's difficult for them to find independence in that. And then again, difficulties in social life and social settings with maintaining relationships with people, or making new friendships with people, which then leads to the social isolation. And then even stress on parents, where the parents feel like they are not in a position, that they don't really have time to be social with other people, to have their own social lives outside of their child, where they have to take care of their child a lot. So it's difficult for them, with lack of resources and lack of education, and lack of a support system at times. And then later on, lack of awareness in the healthcare system. I saw, just in a couple areas during research as well, where especially as they move from that childhood into adulthood, where there's just a lack of opportunities for them, a lack of awareness and just support from other people, from other organizations. And that can definitely cause strain on the person and their family as well. And then genetic inheritance. For this one, this is an inherited disorder, as we were talking about earlier, and other family members can not have this disorder, but be carriers of that disorder, that then lead them to have it in, or to give it to future generations. And then again, this is more common in males, but while females still have it, the symptoms and things are less severe in females compared to males as well. And then lastly, for strategies to mitigate the impact to development, early intervention is crucial for maximizing the long-term developmental outcomes, positive outcomes from that. Speech language therapy is a definite positive impact and strategy that people often take with this disorder, to just improve the receptive and expressive language that we were talking about earlier, pragmatics, and articulation as well, with the comprehension in all these areas. And then occupational therapy with motor skills, coordination, and especially sensory processing issues. And then with behavioral interventions like ABA therapy, and symptom-based pharmacological treatment, which is there to target the specific symptoms of FXS, including things like anxiety, depression that Brooklyn mentioned earlier, ADHD, or other just common health issues that happen just as we are going about life, whether it's frequent ear infections or things like that, that just maximize the reactions that cause maybe OCD or these things to just be heightened and worsen the behaviors there. So just treatment to treat those symptoms of it. And then promoting independence, as we talked about earlier as well, this is a common struggle for a lot of people as they're entering adulthood that have this, that have FXS. So promoting more independence for them. And then for parent and family support as well to provide education, resources, and support to help bear the weight and manage the care and finances that come into this disease or this disorder, and yeah, just living a life with it. So with that, these are references. But this is all we have about FXS. And yeah.
Perfect. Thanks, guys.
Awesome.